Next, we have Devendra, who is going to talk about nuts and bolts of FRCS. Devendra is the chairman of Lakshmi Eye Institute in Bombay, which is part of Center for Sight now, and he conducts the revision course for FRCS, FRCO in Mumbai.
Thank you so much, and I'll be briefly taking you through the nuts and bolts of the FRCS examinations. We can project it on the main screen. Slides. Yeah, thank you. So this is just a background. These are the Royal Colleges. The one in Edinburgh is the oldest, followed by the one in Glasgow, and the Royal College of Ophthalmologists in London has their own parallel examination, which will be covered by other speakers. So I'm going to be focusing mainly on the second one, which is the Glasgow College. The Edinburgh, unfortunately, flips and flops with regard to their examinations. Currently, they're not made available. But let's start with the Glasgow examination. It's a really old college, and these are some scenes from Glasgow where we visited after the examination for the convocation ceremony. This is a very important part of my talk. I always have this slide because that's Dr. Asif Virani from Thane, who was my study buddy for this examination. And it really helps to have somebody you can bounce off your preparation with. So I think that's the first and most important tip that I'd like to give anybody giving this examination. These are a few scenes from the convocation. It's a very prestigious and ceremony full of pomp. But let's get back to the basics before we reach that stage. The examination has three parts, and I'm sure many of you must be familiar with this if you're thinking about giving this examination. Part one is basically the basic sciences and optics, and it's an MCQ paper for 2 hours. The second part is clinical sciences, and again, it has now been condensed into a single part, which is MCQ based. Earlier, there used to be a long answer question of 4 parts, which has now been done away with, and it has now only a single MCQ paper. And the third part, which is the meat of the examination, is divided into 2, which is the structured oral examination, also called the vivas, and the clinical examination, which is where you see patients. So there are 3 and 4 stations respectively. Now, who can give this examination? For part 1, anybody can give the examination. You just need to have finished your internship. You don't even need to be in ophthalmology training. And for part 2, you need to have completed part 1 and 5 years of post-qualification training, which includes your internship. And you should have spent 54 months of that in clinical ophthalmology. And for part 3, you need to complete parts 1 and 2. These are the fees. These are the latest fees, and they increase by almost 10% every year. And initially with Brexit, there was a depreciation of the pound, so it was a little cheaper for Indian candidates. But now the prices are really picking up, so it requires a lot of financial planning apart from your academic planning. So otherwise you end up with a really big headache. And the website says you have a maximum of 6 attempts for each part, but I think before that 6th attempt, everybody will be on their deathbeds because it's you have to wait literally a year before you can reattempt. And just for an example, these are the latest fees and dates for the third part, and you can see that 3 out of the 4 centers, actually there's a center in Bangalore as well. So there are 3 centers which are in India. So you have an opportunity to give this examination in India. So this is the website which will give you all the details, all the curriculum, the methodology, the dates, times, fees, etc., and how to apply. To touch upon the examination itself, it uses what is called the modified Angoff technique, which means that there is no cutoff predetermined pass mark. For our DNB or MS examinations, we have to get 50%, or we have to get 30%, or we have to get an X%. Here, the examiners will evaluate each question and divide it into whether it's an easy question or a difficult question. If there's a majority of difficult questions in that paper, the pass mark is lowered, so more people can pass. Whereas if it's an easy paper, then the pass mark is much higher. So that's how the examination is done. So it's very objective, very well structured, and there's less bias, which is, I think, the real reason that attracts many of us for these examinations. Very briefly, what are the sort of resources for this examination? These are what I used now more than a decade and a half ago. But for optics, I really depended upon Elkington and the lovely textbook by the late and dear Professor Khurana. For the MCQs in basic science, indispensable is John Ferris, and The Eye by John Forrester is also an excellent resource, although it's quite voluminous. For the clinical parts, the MS and DNB syllabus is your core, but you can also try to test your knowledge with this Mass Eye and Ear Infirmary Review Manual, originally authored by Jeffrey Lamkin, but now with a group of editors. There are sections on emergency medicine, so I depended upon the Oxford Handbook of Clinical Medicine. This used to be the sort of gamut of scenarios that you would be faced with or tested with. And this is from the website where they wish you to be able to assess situations, establish a preliminary diagnosis, and sort of stabilize a patient's condition before you refer the patient. And also some aspects of arrhythmia and ECG. I've deliberately put that in because it's something that we have either overlooked, which is why we ended up in ophthalmology, or something that we have now deleted from our memory banks. So general medicine and neurology is tested both in parts 2 and 3. And these are the sort of spectrum of conditions, those which have ophthalmological signs and symptoms, your initial stabilization and investigation prior to referral, treatment of certain life-threatening conditions, and medical emergencies. So a few tips. This entire examination is extremely practical. Even in the theory exam, they're not testing your theory. They will not ask you the percentage incidence of a particular disease and give you 4 options. There is a very methodical manner of approaching the question, and there is a planned answer, and generally the schema flows from something that's life-threatening to something that's vision-threatening, and lastly, something that would be of only cosmetic interest. So coming to the third part, as I mentioned, the structured oral examination is the first one that you will encounter. It has 3 stations of 20 minutes each, where you would be quizzed upon these various topics. You will have 2 examiners, and it really goes in a very fast manner. But it is very structured because it has specific questions and model answers. And if you're able to hit those keywords that the examiner has on the card in front of them, you will do well. Generally, the examiner may wait for you to make a mistake before they guide you, and they do guide you to get back onto a correct path if you are totally off track. There are subparts to each question which builds on your previous answer, so you need to at least start off correctly so that you can be asked the second and third subpart. The clinical examinations is probably the more nerve-wracking of the two, because here you are faced with actual live patients. You have very focused examinations that you need to do. There is there's no history taking that you really need to do except in hindsight, but your examination technique is what is being tested, as well as your bedside manner. So these are 2 things that we overlook in Indian examinations, and this is what is exactly being tested in this. You have 12 minutes at each station. Again, you have faced with 2 examiners. And in general, you may see 3 or 4 patients per station, which means that you end up only examining a patient for 3 or 4 minutes. So you can imagine how focused your examination needs to be and how fluent your answers need to be, or how fluent your description needs to be. I think that is the key of the examination. Try to practice fluency. Even if you imagine a particular case in your mind without having that patient in front of you, you can go through that with your study buddy and try to describe that examination while you are just imagining it in your mind. Practice pays, and there are certain advantages. I won't go into these because these are really dependent on the whims and fancies of the government at that point in time. But in general, FRCS allows you direct registration with the GMC. You do not need to give the PLAB, which I think all of us would consider a significant advantage. There is certain exemption with the ICO, especially parts 1 and 2A, if you've given those examinations. All of us who are interested in these examinations probably like to give examinations, and many of us are giving it only to add to the tail ahead of our name. I always put this slide up. It's a great, a tribute to this gentleman who has, whose degrees don't seem to end, but we don't need to go to this extent. But I think we are all proud of the added initials that we can add to our name. There are certain disadvantages, and I would warn you that they are expensive examinations and they are not licensing examinations. Just because you've cleared the FRCS does not mean that you're eligible for a job in the UK or in the Middle East or anywhere else. You need to look for the specific national guidelines, and obviously in India it is still not considered a valid degree in ophthalmology or super specialty. Sorry. So these are just a few images of the course that we've been conducting at Lakshmi in Panvel over the last 6 years, and after hiatus due to COVID, we are back, and we invite you. You can take down these details if anybody is interested. These are focused, this course is focused on the third part, that is the practical part, and we would have sessions generally in August or September before the actual examinations. I wish all of you giving these examinations all the very best, and even those of you who are not giving the examinations all the best. And I now